some sectors don't have baseline for those indicators. Some sectors who have baseline for those indicators also are indicators, their indicators are sort of outdated. You're reporting from, we are in 2013, somebody reporting 2001 figures, or 2005 figures, or 2003 figures, which we think is not acceptable. We have to go into an exercise to find realistic and reliable information that are also current to inform our policy decisions, to inform our planning, to inform our resource allocations. Therefore, the importance of this DHS cannot be overemphasized at all levels.
Thank you very much.
Thank you.
Mr. Paul Timmendi, the Human Resource and Economist at the National Population Commission Secretariat under the Office of the Vice President, you have a Herculean task also as far as the results of this DHS is important. Why do you think, the results would add, or how do you think these results would add to your, already existing, knowledge on health and also the economy?
Thank you very much, Pamod, and I'll seize this opportunity to thank the viewers. I think it is, as Mr. Sane said, is very, very important. First, it's important at national level. We need data for planning. You cannot plan, in a vacuum. You need something. And what do you need? You need something very realistic, concrete, and updated information. And that's what we are getting from this DHS. Secondly, DHS actually is going to tell us how far we have gone. There are a lot of activities, a lot of interventions, especially in the area of health, population, and nutrition, and other areas. But how do we know how far we have done? How do we measure our success? So DHS is going to provide us with information to measure our success stories. At the end of the day, we'll be able to know where we started and where we are. And it will guide us. So this guidance is very important for all planners. It's all important for all those implementing social and economic programs or any other development. So DHS is so important, and my office particularly, especially at the level of the Office of the Vice President, did a lot of sensitization, did a lot of resource mobilization to ensure that the program takes off. I'm so happy that it has become a successful story. It was a dream when we started, but we really worked hard, and with the support of Her Excellency, we are now at least realizing what we all dreamed for. So it's a very important exercise.
Thank you very much. Mr. Sane, I think the DHS, from my understanding, is long overdue. What do you think Gambians should do as far as this DHS is concerned in terms of coming out, and be forthcoming, and receive your teams well?
Thank you very much, Mr. Njai. I think the role of Gambians into this particular exercise is very crucial, because the information we are collecting is from the people. Therefore, if people are not willing to provide us with the information, which means the entire exercise is futile, we want to seize this opportunity to urge all Gambians and non-Gambians who happens to be part of this sample. Because if you could remember the last time we said, it is entire country, but it is taken. Out of the whole Gambia, 281 enumeration areas were selected. And within those enumeration areas, any household that is found within those enumeration areas, there are 25 households selected among the lot. So whoever falls within those 25 households, whether you are a Gambian or a non-Gambian, we want you to provide us with the relevant information that we are asking from you, from your household members. We also want to urge people, because the issue of Gambia here, we respect leadership. We found some problems that, you go to a household, you don't find the household head. The household members will not be willing to provide you with any information unless and until they take the permission from the household head. So we want to urge Gambians to make sure, let everybody inform your household members that in my absence, if these people come in my household, please provide them with the necessary information that they need. It's good that we may need the household head himself to also participate. In an instance where such a thing happened, they can also provide us with maybe the telephone number of that individual so that we can call on him and ask him to come to the household to provide us with necessary
So
information.
what happens in that case where you go into a compound and you don't have the household cooperating? Do you automatically skip the compound?
No, we don't skip. What we do is still to engage the household. We talk to you, explain the relevance of the story. Do you understand? Both at your own level and also at national level. If you don't agree, we still leave you and come back. We still call that callback. We still make a callback on your household. Try to convince you to make sure you are part of this, because we don't want to allow a single household to escape us.
Okay.
So we do everything possible to make sure we call on you again, try to convince you to be part of the story.
Okay,
yeah.
Convincing.
Yeah.
Thank you. Mr. J, one important thing here, when you look around town, you see compounds at the gates, you have numbers there. But you observe that some of these numbers, some people in the process of refurbishing their compounds, these numbers are painted. Is that number significant?
Yes, that number is highly significant, because these are the numbers that are used for the upcoming census in April. But these are also the numbers that the DHS is using to identify households for the DHS. So whether they do it inadvertently or they deliberately do it, I think people should be advised not to actually pin those numbers, because those numbers are used for identification purposes.
Good. Now the blood samples also that are being collected from individuals, how secured is this test, and how is this testing going to be done? Because some might be very much interested in knowing their status, some might not be interested in knowing their status. So how is this process going to be like?
Well, regarding the DHS, as I said before, samples like for hemoglobin, that's blood levels, samples for malaria are collected and tested on the spot. But samples for HIV are going to be done anonymously. So nobody along the line would know the person from whom this sample was collected. Okay? And all the samples are numbered. They are taken to the public health lab at Kutu, where they are going to be tested, and then the prevalence of HIV is going to be measured using the total number that are collected against the total number that are positive.
Good. Thank you, Venak. I'm still coming. I'll come back to you.
Yeah.
Now, Mr. Sane, research is very important, and I will keep on emphasizing this. But we have both the DHS and we have the national survey on the other side also. How are these things going to take place? And what is going to be the time frame for these two?
For the DHS?
For both the DHS and the national survey itself. That's the census.
Oh, the census you mean? Okay. The census, the DHS has started.
Yeah.
And DHS is going to go up to 28th of April. The census is starting in April. The census is just a total count of the entire population. But we found out that a DHS is a sample, sample of the entire population. You understand? The DHS is providing some indicators that are not going to be within the census. In census, there are no blood samples taken from
yeah, I asked this because some people confuse
the two,
the DHS
and the census. Exactly. We want to tell all Gambians and non-Gambians that the DHS has started. The census is yet to come. The census, there are no blood collection going to happen during the census. And for the DHS, we are interested both in trying to find answers from respondents and also try to collect their blood samples for testing of certain elements. Do you understand? So let them not confuse the two. The people coming into your households are people who are collecting information for the DHS. The census people will be coming later, around April, for the month of April. So let us not confuse the two. Census people will be coming, but the numbers at on your gates are reference numbers for both the DHS and also for the census. Yes, we go to some households where you will not find the number, and sometimes it confuses us. Is this the actual structure that we are supposed to visit or not? We are in confusion. So we want to urge all Gambians and non-Gambians, let them not erase those numbers on their gates, please.
Good. Now, you want to add something?
Just to add something on these two important national surveys. We all know census. We are more familiar with census.
Exactly.
Every 10 years, we have census. But DH is coming for the first time, and as he said, it's more detailed It's looking for certain peculiar